Welcome back, everyone. Well, we know pregnancy can sometimes be traumatic. It's, of course, life-changing. Few expect it, though, to be deadly. The CDC says more than 80% of deaths related to pregnancy are preventable, and Black women are 3 times more likely to die from pregnancy-related causes than white women. Chronic illness, economic status, access to health care can all raise this risk for Black women, but it could also boil down to how your doctor listens to you and whether or not your pain is acknowledged in the first place. Today begins Black Maternal Health Week as we raise awareness about all of this and share with Black moms and moms-to-be what they need to know ahead of pregnancy. Tomorrow, Northwestern Medicine is hosting its 3rd annual Black Maternal Health Open House, and here to tell us all about it is Dr. Jacqueline Hairston, a fetal medicine specialist at Northwestern Medicine. Thanks for being with us. And Daria Siler, I'm saying that right, correct? Okay, a patient of Dr. Hairston's. Thank you both so much for being with us. We so appreciate it. Now, Dr. Hairston, I want to start with you because we know that gaps still exist in maternal health care. What needs to be addressed now?
Yeah, I think the biggest things that we need to address are, one, the maternity care deserts. Hospitals are closing not only across Chicago, but across the nation. And so access to care is a big issue. One of the things that we struggle to quantify or put into numbers is the impact of systemic racism and bias and how it can impact health outcomes. And that's where the future of research is and should be focused on.
Yeah, and it's important to talk about it now.
Yes, always.
Daria, during your first pregnancy, I know that you experienced a second trimester loss at another health system. I'm so sorry to hear that. What do you remember at that time about how your concerns were handled during that time?
Yeah, the best way that I can describe it is being dismissive. It felt dismissive as a first-time mom.
Yeah.
I don't really know what to expect, didn't really know what to look for. I just remember having some symptoms that maybe are not so common or common maybe in pregnancy, and I was bringing those concerns to the providers, to their team, to the nursing staff, and often I was met with, you know, this is kind of normal in the first trimester, or if you advance to this level, maybe there's bleeding or this, then come see us. But right now it sounds like you're just experiencing what is a normal pregnancy.
So some of your symptoms and signs were maybe ignored a little bit.
Yeah.
When you met Dr. Hairston, what did your appointments look like? What was different about that experience for you?
Definitely being heard. I felt like the littlest of things, whether it was pain or nausea, those things were met with, you know, understanding and, you know, some sort of, I guess, intervention to help me alleviate some of those things.
Yeah. Dr. Hairston, when you have a patient like Daria or many others who come in and they've experienced something, you know, a traumatic event related to pregnancy, how do you treat that patient? And what is your experience? How is your experience really different? How do you set yourself apart as a doctor?
I think we have a lot of guidelines on how we should practice and the things that are recommended, and of course we address those, but there's the emotional connection and recognizing the experience that people had and recapping that with patients, being trauma informed, and then saying, well, how can we make this pregnancy better? Understanding that there's still no guarantee, but even in your experience in our offices or for the remainder of your pregnancy during your ultrasounds, how can we tailor it to you? And so sometimes that means a few extra visits in the first or second trimester to alleviate people's fears. That's not in the guidelines, but that's what we would essentially say can help people at ease.
And fear and stress can impact pregnancy, right? So to alleviate that is huge. Daria, how do you hope that your story may impact, you know, other expecting parents?
Yeah, so I think for me, I didn't have any family members or friends that had experienced or gone through what I went through. I learned by being at Northwestern that I had incompetent cervix, and there's a stigma that comes along with that itself. So I guess my hope is to let people know that even with something like incompetent cervix, it's still possible. You can still have a child and be successful in that. And you may just need a little bit more support. And you have doctors like Dr. Hairston out here that will assist you and guide you through that process.
Okay, wonderful. We have an open house tomorrow for who can come to that, Dr. Hairston?
Yes, it's the Improving Black Maternal Health open house, but everyone is welcome, whether you're pregnant or not. We really want people to get that education that they deserve to hear, answer the hot topics. There'll be heavy appetizers and free parking, so we really want everyone to come. All are welcome.
Come and learn more. Thank you both so much for being with us, for sharing your story, for providing all of this incredible information. We will link you to all of that on cbschicago.com.